Good morning, everybody. I'm Aileen McGloin. I'm the Director of Nutrition at Safe Food, and I'm going to be your chair this morning. You're very welcome to the first All-island Obesity Action Forum meeting of the year. And we're very excited to hear from our speakers this morning for our event as we translate research into policy. Before we get started, I do have some housekeeping to go through. Just to remind you that this webinar is being recorded, so we will send you the recording within 2 weeks of the event. You can ask questions via our Q&A box, if you can find that at the bottom of your screen. And when you ask your question, please note the presenter's name if you want the question directed to somebody in particular. Those questions are visible to everybody, so you can upweight them if there's a question that you would have thought about asking yourself. If you have a technical issue, there's also a chat box at the bottom of your screen, and please use that to alert us to any issues that you're having. We do like to spread the news about our events far and wide, so please use X or Blue Sky or LinkedIn with the hashtag Obesity Forum to talk about the event. So without further ado, I am going to move on to our opening remarks from our colleague Fiona Ward from the Department of Health. Fiona is the Nutrition and Obesity Policy Advisor for the Department of Health, and she's well placed as she is working on the next iteration of the obesity policy for Ireland to open this event. You're very welcome, Fiona.
Thank you, Aileen. Can everyone hear me okay?
Yeah.
Good morning, everybody. Thank you to Aileen and the Safe Food team for inviting me to say a few words for today's online webinar. So as Aileen indicated, the Healthy Ireland team in the Department of Health are in the process of reviewing existing policies, including the Healthy Ireland framework, because they are reaching the end of their 10-year tenure. So today's event discussing how evidence translates into policy could not be more relevant for us in the department. So earlier this year, some of you may know, we commenced stakeholder engagement to begin preparations for the development of the new obesity policy and action plan. And this is expected to be delivered by 2026. So over the course of the last 9 years, we know from Healthy Ireland survey data that people living with overweight and obesity is stabilizing at approximately 60% for men and closer to 50% for women. And this data is similar to the figures that were reported in 2022. The proportion of people living with overweight and obesity increases with age, and therefore giving children every possible chance to adopt healthy lifestyle behaviors is paramount to protect population health from non-communicable diseases such as diabetes, cardiovascular disease, and cancer later on in life. Through collaboration with our research partners working on the Childhood Obesity Surveillance Initiative, or COSI as it's known, and the Healthy Behaviour in School-Aged Children study, we also know that 1 in 5 children are living with overweight obesity in Ireland, which is also stabilised. However, the disparity between children living in affluent areas compared to children living in more deprived areas is growing, which is a similar picture seen across the UK and Europe. And this now equates to 1 in 4 children living with overweight and obesity in Ireland. So the need to address obesity through a health equity lens to make healthy food more affordable, accessible, and available are some of the concerns and themes that have already emerged from our consultations to date with government departments, public health bodies, academics, advocacy groups, and other NGOs. So we know that there's an urgent need to do more to protect our children, in particular with regard to the unhealthy food environment that surrounds them and influences their every move, both in the built environment and the digital environment. And even this week, we've had a number of different studies that have been published that would indicate the evidence and the scale of the problem that's emerging. So we have the CLICK study that was published by the Open University, and that came on LinkedIn only just yesterday. And I attended the food poverty needs assessment conducted by the Liffey Partnership called Spinning Plates in the Ballyfermot and Cherry Orchard area, which indicated the high proliferation of fast food outlets in these areas of deprivation. And also Northern Ireland published their FSAI report on food retail outlets proximal to schools only this week as well. So prevention of obesity and treatment and management for people living with obesity is not just a public health concern, it needs a whole of government response. So the multi-sectorial approach thus far in OPAP, or Obesity Policy and Action Plan, has shown some progress, but in reviews conducted by UCC in 21 and is being currently updated, there is much more that can be done to effect change, particularly in improving the food environment through regulatory and fiscal policy measures. So the development of a new obesity policy needs to be informed by evidence-based, public health-focused policies, drawing on national and international research, and developed through collaboration with all government departments and public health organisations. So for this reason, I'm particularly interested to hear from Alison Tedstone, who brings a wealth of experience in translating evidence to action through her work on the Scientific Advisory Committee in Nutrition, and her experience in policy development with the Department of Health and Social Care. SACN recommendations are currently used as a reference to guide food reformulation targets to improve the nutrient quality of food by reducing energy, sugar, saturated fat, and salt in frequently consumed foods in Ireland. And this work is being led by our partners in the FSAI Food Reformulation Task Force through a 4-year programme up to 2025. And given that data from the Healthy Ireland surveys and the IUNA food dietary consumption surveys indicate that dietary intake of fruit, vegetables, fibre all remain suboptimal, I'm very keen to hear from Alison's experience on how we can overcome these challenges by designing appropriate food and nutrition policy in line with the WHO best buys to prevent non-communicable diseases. Having access to an evidence-based toolkit which examines the impact and effectiveness of interventions is important when there's competing economic tensions between delivering public health programs versus implementing healthcare treatment and management services. So hearing from Monique Tan's experience of influencing to achieve at both national and European level will inform the design of a multi-sectorial and multi-level interventions over the short, medium and long term of a new obesity policy. And finally, as we know, only 41% of people in Ireland manage to meet national physical activity recommendations of 150 minutes of activity per week. So the Healthy Ireland team here will find Sven Messing's insights most valuable in advance of the new physical activity plan for Ireland being published. So I'm very much looking forward to hearing from these policy experts today so that we can use the evidence in the development of the new Obesity Policy and Action Plan. Thanks again for the invitation, and I'll hand over to Aileen to introduce the first speaker.
Thank you so much, Fiona. Before we move to Alison, and I'm also really excited to hear from her, there's no such thing, of course, as a free event. So we are going to ask you to do a small bit of work before we get started. I think a lot of you will be familiar with menti.com. The Menti is an instant survey tool. If you would go to your phone and on your browser, go to menti.com. When you get there, please enter the code that you see on screen. So that's 53340387. When you do that, you'll see that we have posed a couple of questions, and we'd like you to answer those for us if you would. The first one is, when you hear the term policy development, what is one key contributing factor or challenge that comes to mind? And we'll see those words coming in live onto our screen. I'll just give a minute for more answers to come in. This is great. And there's 2 words there that are not changing in their stature very much. You'll see them right at the center. You can see the code. If anybody's struggling, the code is at the top of the screen there, 53340387. Great, and it's settled there. So that means that most people, oh, here we go, have probably entered their words. And the trends aren't changing now as more people join. So at the very center there, you see cost and politics and collaboration, along with red tape, funding, implementation. So very much and evidence coming up there a little bit more to the fore as more people enter their words. So that's really, really interesting to see what people are thinking about when they're thinking about policy development. That's brilliant. Okay, I think we can move to the second question. And the second question was, you were giving your view on whether I have a good understanding of how research is translated into health policy, and your options were strongly agree, neither agree nor disagree, disagree or strongly disagree. And most people feel that they have a good understanding of how research is translated into health policy. And we will have a look at that at the end of our session to see whether we've had any impact on that. So thank you very much for taking the time to do that. It's really interesting to get a little gauge on where everybody is before we get started. Okay, we are now going to move to hear more from Dr. Alison Tedstone, who will be very familiar to a lot of people who are already working in this area. Alison, as you may know, is one of the leading public health nutritionists in the UK. She's chair of the Association for the Study of Nutrition, but most of us will know her in her former roles as chief nutritionist at Public Health England and the Department of Health and Social Care. Alison has a long career of shaping national policy on diet, obesity, and food reformulation. She's an expert advisor to the WHO and has chaired major committees, including the NICE osteoporosis guidelines. Today, she'll be discussing her policy journey and the UK's policy journey in relation to obesity. And she'll offer insights into how advice from SACN is translated into policy, the challenges that were faced in developing and implementing policy, and what has and has not been achieved. So over to you, Alison.
So thank you very much. Can I have my first slide, please? I slightly tweaked the title of what I've given because I thought it was a bit arrogant for me to talk about the UK. So I'm going to talk about some of the things I talk about will apply to the whole of the UK, and some of them will apply to England only. So this is just a quick overview of what I'm going to talk about: dietary intakes, why diet is a priority for the UK, policies that we have had come into place, a case study around about sugar, and why it's hard to implement policy. I should also say I did use the lead for Public Health England on physical activity, so I will slightly reflect on that as I'm moving forward. Can I have the next slide, please, and the next slide? So these are data from the National Diet and Nutrition Survey, and actually new data was published from the survey last week, but I haven't updated the slide. It wouldn't change it very much. And this just shows the state of play of diet in the UK, and much the same as for the whole of Ireland. We don't achieve, on average, dietary recommendations. I was interested listening to Fiona talk about inequalities. And what we see in diet, we see that more affluent people have slightly better diets than the poorest in our society, but they're not overwhelmingly good. We shouldn't lose sight of the fact that everybody is, on average, not achieving dietary recommendations. So we're exceeding recommendations for saturated fat. We're greatly exceeding recommendations for sugar. Despite many years of voluntary activity in lowering salt intakes, we're not achieving our salt intakes, and we're not achieving fruit and veg intakes. And the only really good bit of news in this is that trans fatty acid intakes are way below recommendations, and that has been because of voluntary action by the food industry to take trans fatty acids out of their products. So that's great to see. That's one thing that's great to see. Can I have the next slide, please? This is the really killer thing, though, and literally in terms of our data, and that shows, and this is about how high our calorie intakes are. On the national surveys, in common with all dietary surveys around the world, we have underreporting of energy intake. So in the UK, we run doubly labelled water, and that enables us to very accurately calculate energy expenditure. And in a weight stable situation, that tells you what energy excess is. And we see for children who are living with excess weight that they're consuming between 200 and 600 excess calories a day. And for adults, between 250 and 450. That's a lot. If we think that we have more than 60% of adults living with obesity in the UK, and more than a third of children, they are on average consuming more than a third an extra meal a day. This, we need to really bear in mind, this level of calorie intake we're seeing in the population, because this is more than you can exercise away. We have good randomized controlled trials to say that it's very hard to substantially increase energy expenditure to this level. We basically never see it unless you're an athlete. And that tells us that we really need to focus on diet. And indeed, you could argue that the Ozempic's results of the Ozempic drug show that diet is the critical thing in addressing weight. And this is not a small tweak in energy intake. It is not swapping your custard cream biscuit for a digestive biscuit. This really speaks to profound imbalance in energy intake. And I'll come on to why that is in a minute. You'll see more of this kind of thing later on in this series of talks, but this is data that you will be familiar with. This is from our Health Survey for England and our National Child Measurement Programme. And it shows that the weight distribution of the whole population has shifted upwards. Again, from an inequalities point of view, we have seen, of course, disproportionate levels of excess body weight in the poorest in society, but every population group, independent of their income, has increased the level of adiposity they're carrying. So yes, we do need to see this through an equality lens, but we also need to see it through a whole population. Very importantly on this side, we see the proportion living with severe obesity has increased hugely, and that really affects society. Can I have the next slide, please? And this is data from the Global Burden of Disease study that just illustrates what Fiona just mentioned, that that poor diet impinges on us in multiple ways, and affects the burden of diseases within society. So yes, all of those elements, whole grain intake, sugar intake, and so on, is leading to excess disease risk. But the overwhelming factor is the level of excess calorie intake. And I would encourage you to bear that in mind when you're thinking about your obesity policies going forward. Could I have the next slide, please? So we obviously have a free of point of access healthcare system. So this can focus politicians' very clearly, because it affects taxation levels in the UK. We know that the NHS is one of the biggest drawers on our taxation revenue that we have in the UK. And these are data from the COVID crisis, so include COVID, because COVID risk was very much affected by levels of excess weight. But just even taking that out the equation, we can see that obesity-related costs on the NHS are high, as are poor dietary costs. Can I have the next slide, please? So let's just skip over to policy. Moving policy forward, as colleagues well know in Safe Food and in Ireland, is jolly tricky. It's very easy to come up with words in policy statements. It's much harder to drive forward impactful legislation that may change our food environment. And to do that, you need a sweet spot of evidence and all your policy ducks being lined up in the wrong place. And around the world, we've actually seen that's a very hard thing to do. And I'll come back to why that is in a moment. Can I have the next slide, please? So in the evidence piece of the equation is hard, but it is the relatively easy piece. And in the UK, we have a range of departments involved in doing that. And Fiona has already mentioned the Scientific Advisory Committee on Nutrition. They're the key committee that are involved in independently reviewing evidence and giving recommendations for government on diet. They only consider the scientific aspects of diet and health relationships. They do not tell government what to do in terms of this. You know, they might say, this is the sugar intake we recommend for health. Then it is for ministers to accept that into policy, and ministers and government departments to work out how to achieve that, or how to put it on the back burner and think it will happen in a more kind of telepathic way. So can I have the next slide, please? So just a bit more about SACN. SACN are currently looked after by the Department of Health. They support all 4 nations in the UK, and they operate by a code of practice that ensures transparency and that evidence is considered in a transparent way. In the old days before SACN, and indeed this still happens around the world, and we see it happening from think tanks and from opinion formers, people used to kind of just do a commentary on evidence and cherry pick what they thought was the most important studies. SACN can't do that. SACN have to consider evidence in a very systematic way. Their recommendations have to be consulted on. The committee needs to put out in the public what it considers to be everything about the studies and everything that it's taken into account in response to the consultation comments, and consultation public comments are published. You can see here that the final advice from SACN goes on government.uk, and also the advice to the public appears on the NHS web pages. Can I have the next slide, please? I've already mentioned that SACN take a systematic review in how to consider evidence, and I'm not going to spend too much time on this, but basically they prioritize randomized controlled trials and prospective cohort studies. Cross-sectional relationships can be very, very misleading in nutrition. We know that. Small studies can be very, very misleading, so they kind of prioritize quality. And that does lead to some different conclusions from others. Can I have the next slide, please? Policy is trickier. Policy brings in government departments, so all other government departments, including number 10. It brings in Treasury, it brings in departments whose job is to do something very different from the Department of Health. The Department of Health has a very clear job. Its job is to sponsor health, if you like, in the UK. Whereas if you're sitting in the Department of Environment and Rural Affairs, one of your jobs is to sponsor the food industry. It is to grow the food industry. So that, in a way, is diametrically opposed from what that Department of Health's job is. People always assume all the barriers are within the Department of Health, and I can tell you they are not in terms of policy progression, and I'm sure Fiona would say that too. Can I move on to the next slide? And so I just wanted to give a bit of a tour de force of what we've had come into policy over the past, in a way, 20 years actually, but some of this would align with what what you are currently doing in terms of reviewing your obesity policies. So we do have a lot of legislation in place. I think we probably have a bit more than you have in Ireland. We have food standards and cooking embedded in the national curriculum. We have free school milk. We have food welfare food to the lowest income in society for children under 4. And for a long time, we've banned the promotion of high salt, fat, sugar foods to children during children's TV programs. We've also had we've had a wealth of voluntary agreements, and I have views on voluntary what can be achieved through voluntary work. So we've had a salt reduction program, we've had trans fatty acid removal, we have voluntary front of pack traffic lights and so on, and we've had a wealth of health marketing. Can I go to the next slide, please? In 2016, things began to rank up in the UK, and we began to get policies that were more likely to impact on the food chain and affect the food environment, which we know is so critical to shaping people's food choices. We brought in the soft drinks industry levy, which is set at quite a high level. It's a tax set on sugary drinks producers at quite a high level. That has driven a lot of change. I'll come to the end of that. We now have in place bans of promotion of high salt, fat, sugar foods at checkout and at end of aisle and front of stall in supermarkets. And we have a more structured and transparently reported reformulation program than we ever had before. Most recently, we've had improvements in planning legislation that mean councils are more empowered to stop hot food takeaways around schools. And I think that's something that Fiona mentioned that Ireland is grappling with at the moment. Can I have the next slide, please? So I want to just focus on sugar a bit. So a lot of this policy stems from a SACN report. It stems from the carbohydrate report that was published by SACN in 2015. And that report reviewed the evidence around the effect of high sugar foods and high sugar intakes on health, and concluded that high sugar foods and high sugar intake, particularly drinks, were led to increased calorie intake. Before, there had been this narrative, particularly driven by the food industry, that all calories are equal. But we now know through randomized control trials that if you have a high sugar diet, that is helping to drive calorie intake. So not all calories are equal. Of course, they are in a biochemical sense, but in terms of impact. So I suppose I would translate it as tasty things, things that are painted as treats will drive your calorie intake. We also saw relationships between high sugar foods and risk of type 2 diabetes, high sugar foods and risk of dental caries. This report also considers fiber and reinforced the fiber recommendations that we had. So SACN said that high sugar intake should be limited to no more than 5% of calorie intake. This was a big shift at the time. At the time, we were the first country to do this. And it was very much fought against during the consultation period by the food industry. SACN defined free sugars is sugars that are being released from food and sugars within syrups and nectars and fruit juices and so on. At the time, I had a whole range of companies write to me and say, oh, we can help with sugar reduction because we produce nectar, blossom, something or other. And had to break it to them, they were actually selling sugar. And very importantly, SACN said the consumption of sugary drinks should be minimised for all. Ministers at the time went further than that and said sugary drinks have no place in a child's diet, which was really quite a robust statement. Moving on to the next slide. So Public Health England at the time did a review around all the evidence on how to reduce sugar intake. And we looked at everything we could find on drivers of sugar intake. And PHE said, look, you need to go beyond information of food and education. Having a good food label is a really important foundation thing. And your food labels aren't good enough in the UK because they're inconsistent, because they're voluntary. So not all high sugar foods have them on, for example. you need education is really important, but it's a foundation thing, and your intent is really easily undermined by your food environment. And we know that through multiple studies that interventions to just educate people have a very, very transient effect. You also need to do multiple things that really impact on the food chain and do them in a sustained and an impactful way. PHE recommended a reduction in price and place-based promotion, a reduction in advertising, a reduction in the sugar content of food. And they said, if you're going to do it in a voluntary way, you really need to monitor this openly and transparently. Recommended taxation of high sugar foods, particularly drinks, and to do that at a level that was likely to be impactful. Recommended at least 10%, and much, much better public food procurement. We've had public government buying standards for food for a long time. They are not closely monitored and do not apply to whole parts of the public sector. And they said, well, you need to continue to raise awareness. So what happened? Can I have the next slide, please? So in 2016, so it's been a long, long journey since then. We've had multiple governments say they will do these things, make a song and dance about doing these things as though they've never been mentioned, but it's been like extracting hen's teeth. So 2016, the voluntary sugar program was introduced, which is structured and closely monitored, and you can see, and I'll come to that in a minute. Soft drinks industry levy was introduced as well, and then we saw a whole bunch of years later in 2022, calorie labeling in the out-of-home food sector, large cafes, restaurants, and so on. And that was really the first bit of impactful legislation for the out-of-home sector. And then in 2023, we saw a ban on place-based price promotion in supermarkets. So there's been a lot of delay and a lot of policy drag, and that has led to commentators saying, well, these policies have been a failure. The sugary drinks tax has been a failure, for example, because levels of obesity haven't declined. But it was never intended that these things should happen as a single thing, because we sit there within a food system. Can I have the next slide, please? So I talked about the sugar reduction program, and this just shows what we've seen in the sugar reduction program. And you can go into the Department of Health reports and you can see what individual companies are doing on here. And we have seen some good progress in some areas. So we've seen good reduction in breakfast cereals, and we've seen good reductions in yogurts. But we have not seen similar levels of reductions in the very high sugar foods. But what you need to bear in mind is what I've got in red on here, that despite really good levels of sugar reduction in some products, we've seen an overall increase in the amount of sugar going into shopping baskets. And that's because we've seen increased sales of confectionery, largely confectionery and sweets, and other high sugar products. And that's been driven by aggressive marketing and promotion, in my view. So failure to do other things in parallel has had unintended, well, is it unintended? It's a consequence we knew might happen, and it has happened. Can I have the next slide? So this contrasts with the sugary drinks levy, and this was data published in 2023. And overall, we've seen a reduction in sugar levels across the board in drinks. It's been fantastic. It's been the most impactful policy I've seen in my whole of my career, which is long. And we've seen a 34% reduction in the amount of sugar in drinks, despite sales going up. So this is a sweet spot, wrong phrase, where companies have continued to do well, but the sugar content of their drinks have been reduced. You probably, however, cannot replicate this in other food sectors, because if you continue to sell more sweeties, you're going to drive more calories into people. Can I have the next slide, please? So what's been promised? We've been promised extension of the advertising restrictions, and they are now due to come in 2026. That's a big delay. there's a possible extension to the soft drinks industry levy, and there's possible that buy one, get one free will be banned. That's been promised multiple times. So can I have the next slide? So why is it hard to implement policy? Well, it's hard to implement policy because of conflicting priorities across government. As I've already said, health has a very clear job, but other government departments want jobs. They want taxation revenue. Agricultural businesses are big political, but agriculture and food businesses are very important to UK GDP. But we know the economic reality is to grow food businesses overall, you're growing the amount of calories into a population, and that will have an impact on health. You cannot, as a nation, continue to grow your food businesses and expect the weight of your nation to stay the same. I quite often talk to people around the world that were doing my old kind of job, and I was in Australia before Christmas, and I heard exactly the same industry playbook there as you hear in the UK. You hear whispered into ministers' ears that the food industry will say, actually, this is all down to the civil servants getting it wrong. It's nothing to do with us. We're the experts. We know what to do. It's all about education. It's all about information. It's all about exercise. Don't worry about what we're doing over here. And that playbook is very professional. And also, there's a tendency for journalists. So academic argument can actually hinder things. You know, if we're having an academic argument on the side, that can be seen. Industry will say, well, the experts don't agree, so we're not. So you know, there's no evidence, is there? Can I have the next slide, please? So I kind of talked about this already, but there is I heard somebody say this last week, so I just repeat it. The kind of narrative of industry is deny, discredit, and delay. And the food industry has been very successful at doing that over the years. We have seen some great policies, but we've also seen a huge amount of delay. And yeah, it's really important that we have a food industry. They are incredibly important, and there has been some good work. So next slide, please. I just want to talk about this narrative that it's all about education. We know from randomized controlled trials it isn't, because it's really easy to undermine what people's intention. And if you quiz people in the UK, they will broadly tell you, they won't precisely tell you, but they'll broadly tell you what they should do in terms of diet. Can I have the next slide, please? Yet this idea we just need to educate people in terms of healthy choices just does not match the food environment we have. This is data from Access to Nutrition Index, and it shows the amount of food, the healthfulness of what our major companies are selling. And when you look at it, you see that even against a relatively low marker of healthfulness, only about a third of the products that we see within our shops can be broadly classified as healthy. That means that 70% of them are not healthy. They are high in salt, fat, sugar. They will drive calorie intake. Can I have the next slide, please? And we have, from when I was a kid, even 10 years ago, we've got very, very different food environments. The big change we've seen is the delivery apps and the growth of fast food. We're seeing more calories come out the fast food chains than ever before. And as I've said already, they tend to be largely excluded from legislation because they're seen as treats. These are not treats. I never thought I'd live in a universe where it made economic sense to deliver a McDonald's breakfast, and it does. And the reason it does is because of the volume of food being pushed out of those chains. And that will inevitably, if we continue to grow our fast food chains, inevitably drive up calorie intakes. And the delivery apps have been a bad game changer. They don't take responsibility, in my view. They're pretty similar to all the IT firms. They say it's nothing to do with us. what's on our sites. When you're operating dark kitchens, it is to do with you. And when you say, oh, we sell salads, then it is to do with you. Next slide, please. Around the world, food industry always threatens unemployment will happen if any legislation comes through. And this is just from the soft drinks industry that said when the sugary drinks tax came in, there would be 4,000 people would lose their jobs in England. In the UK, I'm not aware of a single person having lost their job as a result of sugary drinks tax. And actually, I'm involved in a WHO committee that has reviewed data on this around the world. People never lose their jobs because of this kind of thing. It is a false narrative, but it is a very heavily promoted narrative. Can I have the next slide, please? So I finally just want to talk a bit about how serious some of this can get. If you start to begin to impinge on food businesses in a significant way, you face court battles. And this was the last job I did for government before I retired. I was the expert witness for government when Kellogg's took the UK government to court over pending restrictions on place-based promotion in supermarkets. And this was very serious. It cost a lot of money. It cost a lot of time. It caused a lot of delay. And there were lots of encouragement for the UK government to walk away from the legislation going on in the background to this. Can I have the next slide, please? You know, and it is bizarre to think you end up in the High Court whether to about essentially Frosties. It's a bizarre thing. At any rate, they made lots of arguments, but their key argument was breakfast cereals are treated unfairly because they're usually consumed with milk, and Frosties are healthy because you have them with milk. That they contain 35% sugar, 35% sugar, I can't remember, is quite beside the point. Anyway, so can I have the next slide, please? The judge, so I won't go through this, but the judge called Kellogg's disingenuous. He said that all their arguments had been well considered. The Department of Health were very able to prove that. And I would really advise, if you want to understand how food industry operate, to read this judgment. It is a really interesting read for those of us who are interested in progressing policy. And Kellogg's are a very big company. When I was there, when I was in court, it did feel as though we were fighting a medium-sized nation. And here's the judgment. It's online. It's well worth a read. Next slide, please. So in summary, diets don't match recommendations. They don't match recommendations pretty well anywhere in the world. We do need to go beyond the easy, and that's information education. Those types of interventions also are expensive. If you're going to put in place interventions that impinge on individuals and you're reliant on that, you need to do it all the time, and that costs a lot of money and it's really hard to sustain. You need interventions that affect the volume of unhealthy food being sold. I would advise that you try that. It also is really important to counterbalance that with healthy food being sold, but you can't just do the healthy. You really need to tackle the unhealthy, because that's what the food chain is. The food chain is largely unhealthy. You need to embrace the whole of industry, in-home as well as the out-of-home sector, and really importantly, delivery. In the UK, voluntary action has been really extensively tested on food labels, on reformulation, and we know that some companies will never ever comply and will do their best to undermine voluntary action, and I would really recommend legislation. Legislation needs to be enforced. Legislation and taxation work, and it's much, much cheaper in the long run than one-to-one interventions. And scrutiny is really hard to deal with from the food industry, because the food industry have a big economic reason for trying to stop legislation. And you need multiple actions to be impactful, and I'm a bit aware of time. So thank you very much. Stop wittering. Thank you very much, everyone.
Alison, thank you so much for that really extensive whistle-stop tour of the journey of policy. There's so much there for us to digest. Alison can't stay with us, unfortunately, till the end of the session to participate in the panel. So we're going to take a few questions now. And there are plenty of questions in the chat, so that's wonderful. Thank you for your participation. Alison, I'm going to start with a question possibly from a researcher or an academic. What can we as academics and researchers do to ensure clear messaging to policymakers and counteract industry narratives that make the evidence base mixed or unclear? So some guidance for our participating academics and researchers, if you would.
And slightly cynically. Been to many roundtables with academics where we've asked them what we should do in terms of policy, and broadly speaking, they've just told us about their next research proposal or their latest research study. And unless you can take a more holistic view of it, that's quite tricky. So I used to spend a lot of my time dealing with university press releases as well as people selling books. And my advice would be to try and be more holistic, to think about what you're doing, to think about whether you're proposing. I suppose academics always say we want more evidence. And I suppose I'm less interested in research studies about individuals. I'm more interested in societal ones. There aren't that many people researching advertising, for example, and I think that's super interesting. So I can't really answer the questions. Academics are a big part of the mix, but they can be really important. They can also be a bit of a hindrance.
Thanks, Alison. We have another really interesting question. In part of your opening slides, you talked about the health costs, but also the economic costs of obesity. And this person is asking, do we ever talk about a rights-based approach and that people have a right to affordable and accessible healthy food rather than a focus on the health or cost impacts?
So we do. I mean, we've certainly tried that argument a lot with particularly for children, the rights, and that hinges on what WHO say, the rights of a child to a healthy diet. And I suppose it's an important narrative. It hasn't really cut through politically that hard. I mean, I suppose because the ministers are so interested in, for example, I do think the baby food industry is outrageous, a lot of what the baby food industry does. And I do think a rights-based approach could be pushed much more. That's a whole separate talk, but some of those companies producing weaning foods are undermining the best possible way to wean a baby. And babies, if we can't protect babies, who can we protect in society? So yes, but it hasn't worked so far. That's the only thing.
And we've loads of questions here. I can hardly keep up with them, which is wonderful. One question, do we know if the sugar levy has actually reduced calorie intake and obesity?
So we have seen Cambridge University did an analysis that suggests it is associated with reduction in obesity rates in adolescent girls. But we have to, so one of the things I'd say to academics is please think logically. Sugary drinks only occupy a certain proportion of calories in the diet. We're seeing all the time an increase in calorie intake, an increase in calorie supply in the nation because of the growth of fast food. So I would say pushback, is that a reasonable hypothesis to test? Sounds like an unreasonable hypothesis to me, because when you think about what's going on in the food chain, and this is the kind of thing the food industry say, that hasn't worked, when all you can expect a sugary drinks tax to do is to reduce the sugar levels or the volume of sugary drinks being sold. You cannot expect it to do by some miracle some overall thing when you are getting to your phone constant adverts from Deliveroo.
No, agreed.
So that's one thing. I'm getting a bit stroppy, but that's
that's okay.
That is what's an unrealistic hypothesis.
Thank you. I think we've time for one quick question. Yeah, I'm sorry, this might not be a great question, but what type of evidence is needed to strengthen the evidence base to support legislative and taxation approaches? So,
Um, yeah, so I would say we've got really quite strong evidence now on taxation. And of sugary drinks. There's been a lot of data produced around the world. And as long as they're high enough, they impact on sugary drinks. In the UK, we structured it so it impacted on the company, not on the individual. I think that's been quite important for enabling it to progress politically. What we don't have so much of an evidence base is around price of unhealthy foods. For example, we've seen excruciatingly high levels of increase of sales of confectionery. That's a really difficult political narrative to say you need to tax those, because I can see instantly the narrative that the food industry, that the sweets manufacturers will drive, and that is that, oh, you're taxing somebody's sweet, some poor little child's sweeties. But actually, that industry does need constraining. So I'm sorry, I'm not answering that question very well because I'm wittering, but sugary drinks isn't the place I'd go, actually, if I was going to spend my research money.
absolutely. And we, of course, here are looking on with anticipation to see, will the 2026 legislation that you mentioned be implemented?
Well, I'm not doing my job anymore, but I've got no doubt lots of delay tactics are being thought about.
Okay. Alison, look, we really, really appreciate your input here this morning. I have so many questions. We could keep you here all morning, but we better let you go as we agreed. Really appreciate your participation here this morning. Thank you very much.
Good luck, everyone.
Thank you. And that is going to bring me to our next speaker, Monique Tan. You're very welcome, Monique. Monique is the principal researcher at Nesta. She specializes there in nutrition policies. She has a background in both public health nutrition and data science, and she has led research in the UK on calorie, salt, and sugar reduction programs, as well as other obesity policies. She works with NGOs such as the Obesity Health Alliance and Bite Back to drive policy impact. Monique's experience spans academia and policymaking bodies, including the WHO and the European Commission. And that gives her a really unique perspective on translating science into policy. So today, Monique, you're going to tell us about Nesta's toolkit that helps evaluate the cost, evidence base, and impact of obesity policies. And your presentation is entitled Raising the Bar for Evidence-Based Policy. We're really looking forward to hearing what you have to say.
Thank you so much. I'm really excited to tell you more about Blueprint, our flagship tool at Nesta, which I hope will answer some questions asked to Alison a minute ago about how to present evidence to policymakers for regulation, like what evidence is needed. So let me tell you more about this. But first of all, for those who don't know Nesta, we are the UK's innovation agency for social good. We're trying to address the biggest challenges in society, and we chose 3 missions, one of which is a healthy life, where our goal is to halve obesity prevalence by 2030 in the UK. So just to be clear, when we talk about halving obesity, it's not about individual people halving their weight. It's about a whole population shift. So to illustrate that, we have here a population, if I can pass the slide. We have here a BMI distribution of the population in 2019 in blue, and in yellow was the distribution in the early 90s. So what we want to do is to move from the blue distribution to the yellow distribution. The blue shaded area here represents people living with obesity currently, and the yellow shaded area represents our goal. So it is an ambitious goal, but we believe in it because it's basically about going back to a state of national health that we've been in before, within recent memory, in fact. So the good news is that there are many ideas on how we could reduce obesity. The bad news is that when 100 things are important, then nothing is important. Like when 100 things are a priority, then nothing is. So what we need policymakers to do is to focus on policies that would give us the best shot at reducing obesity rates, like the blue squares, and pay perhaps less attention to the policies that are talked about a lot, like, you know, Alison's like education information, but would not get us there, like the gray squares. So we want to find a way to identify these blue squares among all the other squares in an objective way and communicate that to policymakers in a persuasive way. So for the past 2 years, we've been collaborating with leading academics, health economists, policymakers to develop Blueprint, which we believe is the most robust and evidence-based toolkit there is to date to reduce obesity. And the primary purpose of the tool is to enable policymakers to compare different obesity policies. And to do that, we had to quantify things in a very standardized way, meaning that we only looked at the effect of policies on obesity. So, for example, even if you had a policy that would have other benefits, like on diabetes or alcohol consumption, these extra benefits were out of scope of the tool. In order to compare apples with apples, we only quantified things based on their impact on obesity rates. So in terms of methods, so first we started with reviewing key reports like the National Food Strategy, Turning the Tide report by the Obesity Health Alliance, and we found over 150 policy recommendations on how to reduce obesity. And we had to reduce these down to about 30 policies, which we thought struck the right balance between showing a range of options while also remaining manageable. Then in a fairly academic way, we conducted evidence reviews to find the best available evidence out there for these 30 policies. We screened over 300 studies. And then we wanted a tool that is not just Nesta's view on things. So we convened the leading experts in the field to form our expert advisory group. And with them, we agreed on the gold standard method to model the population impact of the policies on obesity. But at some point, we had to move a bit away from the academic world and actually talk to the intended users of the tool, which are policymakers. And we've done some user research with them and how they'd like to interact with the tool. We also commissioned independent health economic modeling to cost the policies, because that's, of course, a key factor for decision makers. And because we really wanted to have high confidence in the tool before launching it, we also presented our findings to a wider range of academics who probably agreed with our results. So the key metrics we report are impact, by how much would a policy reduce the national prevalence of obesity, evidence strength, how strong is the evidence behind each intervention, and that's different from impact, right? Like you could have really strong evidence that something does not work. Cost to government and monetary benefit to government. Benefits actually proportional to impact, because the larger the impact, the greater the benefit. And we're really transparent about how this is calculated. So for example, on the website, you can find a technical appendix where you can find the details of how we modeled the impact metric, for example. So we used here the Kevin Hall model, which is the same that is underlying modeling done by the Department of Health. We won't go through it, but just know that it's all on the website if you want to look at it. And here is the website we launched last year, September, I think. That's the landing page. When you scroll down, you see a list of all 33 policies, well, only the first few here on the screenshot. At the top here, you can find 3 sliders. So say that if a policymaker wants to see policies with a large impact, good evidence quality, low cost, then they can only see that subset. And then say, if they were to click on the first policy here, they would land on the policy page. So each of them look the same. You have the actual numbers for the metrics. They could download our technical report. If they scroll down on that same page, they get a longer policy description, more contextual information, and further down, I won't scroll down, but further down, they would get a breakdown of the numbers. And the reason why we put the contextual bit first instead of the breakdown of the numbers is because our user research showed that policymakers actually found that type of information more helpful. And still on the website, you will also find the same policies, but now presented as packages. So, for example, the first one, prevention and treatment, that is a package that would have a large impact. It's got high evidence and lower cost. So broadly, there's a package that's focusing on improving our food environment, which, as we heard before, it's really needed to, turn the tide on obesity. And that's addressing the food environment from different angles. So you have a policy, the second one, that is about supermarket retailers, large retailers. Another one, the third one, about the out-of-home sector. That's, out-of-home sector, we mean cafes, takeaways, restaurants. One about delivery platforms, one about restricting advertising. So it's all about improving the food environment around us rather than placing the blame and the burden on individuals to change their behavior to lose weight. And that's really important if we don't want to widen health inequalities, as we talked about earlier, right? So because we know there's a social gradient to obesity. And you may see the last policy here is actually extending access to GLP-1s, because we also want to take care of the people who are at greatest risk of ill health due to obesity. Here you have the second package. Sorry, not the second package, but here you have the different impact of each policy of the first package. And you can see why it's powerful to present policies as a package, because if you look at the bottom right, you can see a tiny purple square, and that square represents a policy that is around mandating data collection. So obviously getting more data on its own won't help, won't do anything to obesity itself, but it is the foundation for other policies, like the biggest one, like here, the blue ones that are doing the heavy lifting. So second package, that would get us to our goal of reducing obesity by 50%. This package is more focused on regulations and taxes. So we've just done two packages that would work, that would get us to our goal of halving obesity at a reasonable cost, just because we wanted to show some different examples to policymakers, but we aren't too fussed about how to get there, which package is done. And then the third package is the treatment only package. It's a bit of a straw man one. So that's just to illustrate how, like, if government wanted to treat their way out of obesity instead of doing prevention, we actually modeled what would happen if you give every single person living with obesity a course of GLP-1 drug. So first of all, that would cost £42 billion, which government may not have for obesity. And second, it would not get us to halving obesity. So much more expensive and less impact. And the reason why it's not having a larger impact is because when people would complete their course of GLP-1, they tend to put most of their weight back on. And finally, the last package is about policies that are often talked about, but so when talking about obesity, policies that people like, and they could have lots of benefits, and some are impactful, but just not impactful enough to get the magnitude of change we want to see at a national obesity level. So now if we take these four packages and place them in this diagram, and this is my last slide. In the green quadrant, you'd have the 2 packages that would get us to a 50% reduction in obesity in 5 years' time at a reasonable cost to government. And you can see that the other 2 packages would not be as impactful and would cost more. And that is the beauty of quantifying things. That's what's novel with Blueprint. The evidence base is not new. What is new is what we've done, that what we took that evidence and packaged that in a way that enables that kind of comparison for policymakers. So hopefully that talk gave you a bit of curiosity around the Blueprint tool. I encourage you to go on the website, have a play around. It's a beautiful website. It's fun to use. I look forward to answering any queries you may have in the Q&A later.
Thanks, Monique, and thank you for an incredibly clear overview of the background to the tool. That's really, really exciting. I was watching it with great interest last year when it came out. As I said earlier, Sven and Monique are going to answer their questions together at the end. So please pop your questions to Monique, I'm sure you have many, into the Q&A box, and we'll come back to those later on. And I am going to move to introducing our next speaker. So Sven is going to move to physical activity. He is a Marie Curie Fellow at the University of Limerick's Physical Activity for Health Research Centre. He has a PhD in political science and over a decade of experience, and his work focuses on policies to promote health-enhancing physical activity across sectors and political levels. His research also explores the link between physical activity, climate change, and human rights, and he brings this interdisciplinary perspective to advancing public health through policy. Today, Sven is going to talk to us about translating physical activity research into policy. Sven, you are very welcome.
Okay, good. So thank you very much. Getting started. Okay, it's hard to speak after 2 such excellent presentations, and I look forward to the discussion at the end. And it was really, really great for me also to learn from the others. So I'm going to talk today about the field of physical activity policy, which is of course related. But I also would agree with what Alison said earlier, that maybe from an obesity perspective, nutrition has the higher impact. But on the other hand, physical activity has a lot of other health benefits on reducing non-communicable diseases. And so there's also a strong evidence for the health impacts of physical activity, but it's not only linked to obesity, but also linked to other health behavior or health effects. So start with a very brief overview of why physical activity is important, as not all of you might be specialized in this field. So the go-to document when you want to learn about the health effects of physical activity is these are the WHO guidelines on physical activity and sedentary behavior from 2020. And there you can read about the health effects of physical activity. The recommendations is that any amount of physical activity is better than none, and you have specific numbers for each age groups on how active you should be during a week, and what the intensity of this activity should be. So these is a WHO document, but you have just recently in Ireland, 1 year ago approximately, Every Move Counts was published. That's the National Physical Activity and Sedentary Behavior Guidelines. The content is it's not very different from the WHO recommendations, but there was an evidence update, so there is some details might be updated based on newer evidence. And also importantly, there was a lot of effort done in thinking about communication of physical activity guidelines. So how do you communicate them to the population? And you have images like this one that visualize for different age groups how active you should be. And if we just take for example adults or older adults, the recommendation is 2 hours and 30 minutes of activity per week, and this would include all people, also people living with a disability or with other health conditions, and just to be as active as you can be, having the aim of 2 hours and 30 minutes in mind. The reason why we need these physical activity guidelines is that physical activity is perceived as a public health problem, and the global data are that you have a study that's already a bit older that calculated the effects on premature death per year and found out that 5.3 million people, 5.3 million deaths per year could be prevented if activity rates were increased. So yeah, and you see the number of adults and adolescents that are inactive. These are global numbers. The Irish numbers are slightly different, but still you see that the number is high. And the reason why the numbers for adults and adolescents are so different is that if we go back to the physical activity guidelines for children and adolescents, the recommendation is 1 hour of physical activity every day. For adults, it's 2 hours and 30 minutes per week. So that's why the children and adolescents should move more. That's why the percentage of adolescents fulfilling these guidelines is a bit higher, or considerably higher. What is also important to know is that there are several risk factors for physical activity. So, for example, you have a higher risk of being in average, people who are female, who have a higher age, who have a lower income, lower education, people who have a migration background, or people who already have a non-communicable disease would engage less in physical activity. So it might be important to focus on such population groups when we think about physical activity promotion from an equity perspective. So from a more political perspective, when we talk about physical activity promotion, we know that many different sectors are relevant. So it's not only the health sector alone that can achieve a shift in population levels of physical activity. It's cross-sectoral effort, which needs also the sports sector. It needs active travel, urban design, community-wide initiatives, initiatives in school. And this, what you see here, it's from a document called The 8 Investments That Work for Physical Activity, which was published from the International Society of Physical Activity and Health. So that's sort of a scientific consensus on what settings and sectors are relevant to promote physical activity. And for each of these sector settings, there is a lot of research, and these are just some studies that are, especially from a political perspective, when you look at what public policies in each of these sectors work to promote physical activity, a lot of research was done in the last years, and you can, basically we know what works. But when we know what works, it's the question, how do we translate these findings into policy? And there are, maybe to start with, what is a public or a policy? Just definition is whatever governments choose to do or not to do, and it's considered as a set of activities. So it's always connected with activities. And in the physical activity space, relevant policies are first of all, at global level, the WHO published a global action plan on physical activity. European Union published council recommendations on promoting health-enhancing physical activity across sectors. At national level, you would have in many countries national physical activity plans. That's the current one for Ireland, but we already heard today that an update is already developed and about to be published in soon. And then, of course, within these action plans, you would have specific actions. And this is just to choose an example, not from Ireland here today. In France, you have had the policy in advance of the Olympic Games that in schools, children should be active 30 minutes every day. You saw the recommendation was 60 minutes, and the idea was that if they do half of this activity during school time, half of it at home, they have a realistic chance to fulfill their activities. So at the end, these are high-level policy documents, but it's always about the specific actions and what happens on the ground to promote physical activity. So how do we translate this research into policy? So I want to talk about 2 examples. One is I showed the EU document, the EU recommendations. So the EU has a monitoring framework for these recommendations, where they would collect every 3 years from all EU member states data on how are the council recommendations implemented, and you would have 23 indicators every 3 years, new data. And the idea or the logic of change is, if I interpret it right, that if you ask governments every 3 years, have you done this, have you done this, have you done this, then there is a chance that after sometimes they will implement all these actions and hopefully achieve policy change. Second example, and this is a tool that was also developed, the development was led by the University of Limerick, but in collaboration with partners from all over Europe, which is called the Physical Activity Environment Policy Index. For those of you working in nutrition, you might know a similar tool, that's the Food Environment Policy Index, which the University of Cork led on. And yeah, so this is basically the sibling tool in physical activity, and this tool has been informed by all these evidence, by all these reviews that I showed you on the effects of public policies to on changing physical activity levels or improving the physical activity environment. So what you would have is two components, policies and infrastructure support, and within the policy component you would have 8 domains. These are the 8 domains from the 8 investments that work. And within each of these domains, you have a couple of indicators that would tell you how would an ideal policy look like in this field. So what are good practice indicators that could guide government action on promoting physical activity. And this could be, for example, in the education setting, something like that you need physical education policies. Physical education should be mandatory, should be evidence informed, should be delivered by qualified teachers, and so on and so on and so on. So you have all these evidence is collected in these good practice statements, and then there would be a process that basically, when you use the tool, that you would collect. Sorry, to go to the next slide. Yeah, so that you would collect all the evidence for all these 45 indicators on what policies exist in Ireland, and you would have also information on how well are these policies implemented. Because you could have an action in a national policy that says we need to build capacity, and then you are interested what happened to build capacity. Were thousands of people trained or were 20 people trained? And this makes a difference. So you would collect all this evidence on the implementation of policies. These are also very often data that are collected either by in single studies or also by governmental departments themselves. And you would have a long document that's for Ireland. I think it's around 170 pages, so that's nothing you would read from the beginning to the end, but where you could look for your particular sector or for the policies that you're responsible for on what the findings are. But I think what is more interesting, because that's more sort of a background document, and a second evaluation product of this is that you would have people, non-government stakeholders coming together and rating this evidence. So you would ask, what is the extent of implementation? And you would see that this differs across the policy domain. So where you see there are some, the policies are very well implemented in the education domain, in public education, community sport. And you would also have, here is one example from the workplace domain where the expert said the implementation is actually very little. However, that's just the second step out of 3. And the third step of this evaluation process, and that's, as you saw, for all the sectors combined, would be that the people involved in this process, the experts, would come up with policy recommendations. And there might be a lot of policy recommendations. So you have a process of ranking the policy recommendations and rating them, once based on their importance, and second based on their feasibility. And the policy recommendations that would score high, both in importance and in feasibility, would be summarized here in sort of a short list that would be sort of an expert consensus on what would be done to support physical activity policy development at a national level. And there you have then very, very specific recommendations. For example, number one in school, to allocate a post of responsibility for a physical activity lead in every school, both at primary and post-primary levels. You would also have, what is the second example I wanted to, yeah, or something like, yeah, I mean, you can read it yourself, but yeah, build capacity of staff across health or social care settings to promote awareness of physical activity. And so very specific recommendations that come out at the end. You might have had, I think, maybe around 40 recommendations. So this was a longer list, and you would have at the end 5 recommendations in the policy domains, 5 in the infrastructure support domains. And I think just want to say that this, of course, is not the only tool. You would have a couple of other monitoring and evaluation tools. Also, most of them or all of them would have results specifically for Ireland. But I think when we think of the 3 evaluation outputs, so sort of an evidence document is something that several of the tools do, and it's also valuable information. You would have also several of the tools that would give you some assessment of what is good and not so good in specific sectors on physical activity policies. But as far as I know, the PA-EPI would be the only example that would come up with specific policy recommendations at the end of the process. And similarly, of course, the food EPI in the nutrition sector. And I think that's an important step of translating research into policy. And I think that was also something that we heard earlier, that very often the researchers present the findings and are interested in maybe upcoming research, but here you would have a specific output that would speak to the policymakers. So just some final thoughts on how these evaluation tools are used. And this is more sort of a general reflection based on an ongoing study. So I think what we can see just in general in the literature is that you would often differentiate between the use of the products and the use of the process. And the products, you can imagine, there are these policy recommendations or evidence reports, and it's the question whether this informs other processes or not, but also the process equally and might be important, especially in physical activity. You can imagine this is it's a rare occasion that all people working on physical activity come together. There are certain structures, of course, within the governments, but this is very often already an important step, and not only in Ireland, also in other countries, to bring people together working on physical activity, each within their own sector, following their own logic, and thinking also about connections you might have between different sectors. Also, maybe more specifically about the use of evaluation, you can think of instrumental use. So I mean, that's the ideal, that you would have come up with the recommendations, and this is immediately translated into a policy. Equally, you might have enlightening use, where you would say, oh, the involved people were part of the process, and they learned about physical activity policies without maybe making immediately a decision, but it might inform future decisions they make just by being part of the process. I think there are also some examples where people would use such findings to legitimize maybe positions they had already before, but they said, oh, there is this additional evaluation process that confirms our position. So it might help for certain actors, stakeholders, to advocate for certain topics. And of course, and then for some of the tools, you know that it's happening on a regular basis every 3 years, like we heard from the EU. Others would also do it every 2 years, every 5 years, or something like this. So that's also a way to do it just on a regular basis and seeing how things develop over time. And now I'm coming slowly to the end, just that's also learning from political science study that would give guidance. We had a similar question in the Q&A chat earlier, how to influence policy as an academic. And I think what we can take from this systematic review from political scientists is that doing high quality research is just one of the parts. Of course, it's the foundation. I think we heard this similarly in Monique's presentation. It's all equally about the communication of research to policymakers, make the research relevant and readable, but it's also about the engagement with the policy process, being accessible to policymakers, and so on and so on. So I'm just saying that I talked about the first two aspects mainly, but there is more to look at. So yeah, what are the take-home messages from my talk today? I think one is that intersectoral collaboration is important. Many of you are aware of this, but just wanted to highlight this again, especially for physical activity. The second is that we know what works for physical activity promotion. We have all this evidence. So now it's time also to translate it into effective strategies, interventions, or policies. We also know that there are a couple of knowledge translation tools to bridge the gap between research and policy. And also, I think we need to critically reflect on the use of these evaluation products and processes within policy. Yeah, that's it. Just to acknowledge that, of course, this is not only my work alone, but a couple of other colleagues from both academia and policy and practice were involved or consulted this project regularly. Thank you very much.
Ben, thank you so much. I really appreciate the extent of the overview that you've given, and particularly that emphasis on evaluation. So I would ask both Sven and Monique to be ready to take questions. We have loads, so that's always good. Monique, we might start with you. There are several people curious to know, have you seen the tool being used since it was launched, or how have you seen it been used since it was launched?
Yeah, so we've been monitoring click rates on the website. I don't know the numbers, but slightly provocatively, I would say that's not really our key metric here, because ultimately, like the key decision makers for obesity policies, like it's not many people. They could fit in a single room, right? So it's more about how to reach these people, like say 12 people, as opposed to like thousands of people, other people clicking the website. So we actually have a policy team that are specialized, that like really professionalizing policy influence and getting really like close to these key decision makers. And it's more about us briefing these key decision makers in a more private context, and then we can refer them to the website. And honestly, the fact that we have a snazzy website with all the information there in a transparent and objective way we're not really expecting policymakers to go and click and download all the appendices, but it's more the fact that they know that it's there, it adds credibility and it legitimizes our tool and like the years of work that has gone behind it. So it's mostly used by us to aid our policy influence work.
Brilliant, thank you. And Sven, a question to you. There seems to be a lot of collaboration in the physical activity space for monitoring and evaluation. And does this continue between research and policy?
Yeah, so I hope I get this question right, but so this continues. So it's what I was like when I was referring to the Irish results of the PA-EPI, for example, then these are, I think this was mainly conducted in 21 or 22, and there is currently a project funded that would repeat the process in Ireland, but also in 5 other European countries, in the Netherlands, Germany, Poland, Lithuania, and Romania. So there will also be some kind of maybe intercultural learning on how policymaking works in different countries, different contexts, but specifically for Ireland, yes, there will be an update. And I think that's maybe also relevant if people, like some of the guests today are interested in getting involved in this, then please feel free to reach out to me and I can connect you with the colleagues who are mainly leading on this. But yeah, so there will be an update, but also for some of the other tools that I had on the slide, I know that they are working on updates of their respective evaluation outputs. So yes, this continues. And also maybe important in this context is that so the National Physical Activity Plan will be updated, and there is an implementation group for this policy that's mainly government departments, but also researchers. And of course, once the new plan is out, then I believe there will be a lot of action to implement.
Dare I ask, is there a date for the launch of the report?
I think the official wording, it's expected to be published imminently. So
Okay. Very soon.
Just
Very
a matter of few weeks. It's ready to be published. It's a political decision.
Yeah, we're very much looking forward to it. Another question for you, Monique, if you don't mind. Does the Nesta tool allow for trade-offs and interactions for different policies and packages?
Yeah, so we thought about this, like the combined effect of different policies and packages, because we know that, yeah, policies interact with each other, they impact each other, and the whole may be greater than the sum of their parts. But we weren't able to find enough evidence for this. And our expert advisory group actually advised us against modeling combinations of policies, because I would be making too many assumptions, too many unknown factors. So in our package, we are basically it's just a sum of the individual policies. We're not modeling interaction there.
Right. And I suppose in a way, a related question is, can they be updated then as new evidence emerges?
Yes. So actually we do have an updating plan. So to mark the pivoting we're pivoting away from technical building of the tool to policy influence, but we'll keep updating it. So I can tell you a bit more about two distinct phases of the project. So in the development phase, which was 2 years, our aim was to build a tool, huge project, lots of people working on it, lots of hours spent designing it, developing methodology, implementing it, launching the tool. And now we're entering the maintenance phase where we're done building the tool. The aim now is to keep the tool up to date, trustworthy, and used by our key target audiences, like audience of policymakers. So it's fewer people working on it, just 4 of us now, very much dialing down on the technical work in order to dial up on the policy front. But we want to keep the tool as up to date as possible. We don't want it to go stale. We don't want people to stop using it. So we'll do regular scans for new evidence of all policy changes or cost changes, and update when there is a step change. Like when the impact, cost, or benefit numbers would change by at least, say, a relative 5% at least, then we would probably update a policy. But if not, probably not going to update for decimal point changes.
Yeah. Okay. Okay. Let me see. Sven, you talked about different sectors working together to promote physical activity. And obviously a large part of our audience today is part of the health sector. And is there any specific advice that you would like to give them from a policy perspective?
Thank you for the question. I think it's, of course, I could have added a few more examples. I think what is maybe a very recent policy that was published, and also some of you might be aware of it, is the physical activity for chronic conditions framework or policy. And I think that one part of this is really to get this intersectoral collaboration working also at the local level between the health sector and the local sports partnerships with physical activity for health officers in the health sector. So I think that might be worth to look closer into it. I've heard presentations about it, but I couldn't present about it at a high level of detail. But I think that's maybe one of the very recent policies where I think a lot of research also went into the development of this particular policy, and it helps to bridge the gap between health and sports sector, as I've heard. But would be interesting.
Yeah, it was really nice to see some of the language and the framing for inclusivity and equity that you had shown in some of the slides there. So that to me is a kind of a step change in how things are being done. So that's really, really welcome, I think. Some questions for all speakers. This is about a two-pronged approach to obesity policy. So we need to both take a preventative approach to reduce population levels of obesity, but also to address obesity in those who are living with obesity. So from your own perspectives, could you comment on that, or say what would be your first step in that regard?
I can go first. So preventing. So this is what our recommended package would do, right? We would try to
So
improve.
it's the dual approach of addressing population level while addressing those. Yes, your first package, I think, is exactly
first
what-
package, right? So the
Yeah.
prevention with improving our food environment in a way that really impacts the population as opposed to individuals, but also then extending access to actual like pharmacological drugs for those who are most at risk. So
Perfect.
prevention and treatment.
And Sven, is it being considered in that perspective within the forthcoming physical activity policy?
I mean, I can't so don't know the content of the upcoming physical activity action plan, but what I think in general in this field, I think it's a lot about prevention. Of course, it's also about the ones living with, for example, obesity or with chronic diseases and so on. And I think this is maybe often considered as a task maybe of the healthcare sector, even though all programs and so on should be inclusive. Maybe health might have a particular eye on this. And I think most of the other, I mean, for physical activity, it's maybe easier because when you do it at schools or when you promote active transport, it's automatically also prevention and it's not treatment. So for most of the other sectors, it's maybe easier. And also I know that Sport Ireland, for example, would also, or the sport sector in general, would have an eye on keeping sport participation at high rates, because sport participation also declines with age. And if you can develop strategies that work for keeping people who are already active in the sport and ideally bringing more people in, that's also helping from a prevention perspective.
Thanks a million, Sven. Okay. This is a challenging one. Do you think policymakers will implement the policy suggestions to tackle obesity? I suppose it's a question about your own philosophies, how hopeful you are. I'll start with Sven maybe on this one.
Okay. So maybe I can start. So there were 10 recommendations out of this PAEPI that I showed you. And I mean, the good news are that 2 of these recommendations are already implemented. One is the update of the physical activity guidelines. The second one is related to the physical activity for chronic conditions framework. However, it's of course the question, there might not be a causal link necessarily. So it is. It was just at this time when the tool was conducted, this was the feeling of the people. Yeah, this would be an important next step. But of course, the tool. Yeah, there were. I know that there were other processes and the history of updating the guidelines or developing the PAC framework. These processes already started before, so it might not be an immediate impact. But I think it's. Maybe my take on this would be that, of course, policy development is taking time, and you might not always expect to see results in the next 2 to 3 years, but it's a long-term process. So but that's of course also making it very hard to assess the impact of such tools. I don't know if Monique, if you have different experiences.
I think the way we see is that, I mean, there is the moral argument on why we should tackle the obesity issue, and the moral argument would be enough for us. But then sometimes you just need to present like the cold numbers and say, okay, here are the costs. Here is how much obesity is costing us on a yearly basis. Here's how much you could save if you reduce it. You know, this is a benefit. So, and the quantification of things, like that's what we like doing. And I'm not going to say too much about this, but there might be some of our recommendations getting into, we'll have the 10-year plan, 10-year national health plan announced this month, I think. well, it should be this week or next, and there might be something from us in there.
Yeah. Let me see. Okay. We have a couple of questions on schools. The question here is, schools have a vital role in creating the environment for prevention. How are schools going to be included in the process in Ireland? I think that's more likely to be directed at yourself, Sven, and maybe a comment on how the evidence around school-based policies are, how the evidence is stacking up.
Okay. Yeah, that's maybe, so it's not easy for me to answer this question because I'm obviously not from Ireland, so I also don't know the Irish school system that well. But just what I can say is I think there is some potential. I think that you have these regular school inspections, I know, and they would, for example, look at physical education, and which is of course important to promote physical activity. And I think if you would, if there are ways that are not connected with a too high workload of people working in this space, but to broaden this perspective a little bit and say, okay, it's not maybe there are other aspects that would require a little bit of more time, but not too much. And you would also have additional information on physical activity from a more general perspective, not limited to physical education. I think that would be highly interesting, and but equally in schools, that was one of the recommendations of the PA-EPI, that you would have a physical activity representative in each school. Again, I know that the burden on teachers is high, and that maybe might just be a smaller role, but at least to have some responsibility, one maybe group of people coming together each school year thinking about what can be done, what can be improved. I think that would be a step forward. But again, I don't know the education sector too well to know what is already happening in this space.
That's really helpful. It's good to see it coming up in the EPI PA evaluation as well. Folks, we'll have to leave there on questions. There are loads more. So you've obviously evoked a huge amount of curiosity in our participants. So very, very sincere thanks for that. I am going to try to summarize that incredibly interesting and dense set of talks for this morning that gave us such a comprehensive overview of this area of translating research into health policy. We started with Alison's wonderful overview of the journey in England to, I suppose, the last decade of a much greater focus on the food environment. She highlighted the overconsumption of calories and sugar in particular, and talked about barriers such as the competing priorities of different government organisations and the strong voice of the food industry and the playbook of the food industry in delaying progress in this area. So we got a wealth of, I suppose, that pragmatic view of being in the trenches with trying to move the evidence to policy and all that is involved in that. And then, Monique, you gave us your wonderful overview of the and how you got it to such a succinct and clear presentation. I really have to commend you on that, of the background to how Nesta brought this incredibly clear tool for assessing the quality of evidence, the impact and the cost of different policies, and that wonderful way that you've packaged it to make it so much more easy to understand for all of us who are working to either develop or implement a policy. And Sven, thank you for bringing us that physical activity perspective. I kind of looked with envy from the nutrition world at the emphasis on evaluation and all of the different tools that have been being used. Fiona told us about the context, which is that the Irish obesity policy is in the process of being developed. In Northern Ireland, they're a little ahead, and it really is very close to publication. But we're at a point on the island of Ireland where there's going to be huge amount of development in terms of obesity policy. So to hear about that focus and to learn from the physical activity perspective on that focus, I think is really, really important. I don't know if you remember that Alison showed a Venn diagram as part of her presentation earlier on, and it showed that interaction between evidence, politics, and implementation, and the sweet spot in the middle. And I think all of you have touched on that. And that is what I'm going to take away as a clear message from all three presentations this morning, that it is a complex process, that the evidence is only part of it, that the political will then comes in, and then of course all of the work happens after the publication of the strategy when we have to move to implementation and evaluation. So I really appreciate all our speakers and Fiona for her lovely context that she gave us just before we started this morning. I appreciate all of the input from you as participants. We had more questions than we could get to, so that's always a good sign that we have got something right. If you would give us just another couple of minutes of your time, we're going to go back to menti.com. You may still have it open on your phones. And if you do, you might still have it in the right code, which is 53340387. I'll give you a minute to enter your answers again. Looks like there might be an error there where the Menti thinks it's you're answering the same question again. I'm just speaking out loud for my colleagues in the background. Maybe that's not going to work. Okay, I think we'll just leave that for the moment. We may be able to, oh, there's no new question. We'll leave it there. Apologies for that, folks. We'll just leave that there for the moment. We may be able to ask you to fill that in later on. Again, no such thing as a free event. Of course, we would really value your feedback. The feedback that we get at the end of these events allows us to improve what we do at the next time we host an event, which will be in November later this year. So any feedback that you can offer us would be very much appreciated. It helps us get things better as we go forward. And when you log off, you will automatically be brought to the questionnaire. So without further ado, I am going to close this event and enjoy the rest of your day. Take care.